But in the changing landscape of healthcare, we need to take proactive steps to ensure our residents have continued access to primary care. That's why we're announcing That's why we're announcing a package of additional steps to help Rhode Island recruit and retain primary care providers. First, I'll be submitting a budget amendment to accelerate a review of primary care provider rates. For 2 years in a row, I put a budget recommendation for this review, which will help determine how our state needs to adjust its Medicaid reimbursement rates to create a more competitive job market. The proposal I'll submit will recommend that the Office of Health Insurance Commissioner complete the primary care rate review 1 year earlier, putting us on a better position to re-examine these rates. Second, we are creating a $5 million grant program to help primary care practices serve more patients and recruit new primary care physicians, nurse practitioners, and PAs. Here's how it works. A practice can get up to $75,000 if they take on additional patients. A practice can get up to $300,000 for hiring new primary care physicians or mid-level providers. New here is an important designation. It means recent graduates, providers from other states, providers from our other specialties, or providers from recently closed practices like Anchor Medical. Applications will be available at eohhs.ri.gov. Third, our administration recently implemented new regulations requiring commercial health insurance companies to increase funding for primary care reimbursements. The goal of these regulations is to have commercial insurance companies doubling per member primary care spending by 2029. Those regulations are now mandated a 20% reduction in prior authorization requirements. That is better for patient care, and it reduces administrative burdens for the practices. There are a few other recent actions my administration has taken to strengthen Rhode Island's primary care system. Earlier I mentioned Anchor Medical. In response to its sudden closure, I submitted a budget amendment that would require large physician practices, among others, to provide quarterly financial reports to the state. This will create an early warning system that will allow us to problem solve with financially troubled healthcare organizations before they reach the point of no return.